nerve damage. Those two words strike fear into the heart of facelift patients and facelift surgeons. Now, there are two primary kinds of nerves in the face: nerves that give the face sensation and nerves that move the face. So sensory nerves, there is some degree of normal, expected, unavoidable nerve damage that happens with facelift surgery. Now, that's temporary. When you lift up the skin and put it back down, lifting up the skin is like rolling sod up out of your yard. And when you roll the sod up, all the little grass roots are temporarily disconnected until they grow back down. That's the same with facial skin. I tell my facelift and neck lift patients, expect about 3 fingers worth of numbness in front of the ear if you're having a facelift, about 3 fingers worth of numbness behind the chin if you're having a neck lift, and expect that area to slowly shrink, recede in about 6 months' time. That is totally normal, totally expected, totally unavoidable. Sometimes as the feeling comes back, people will get formication, which is Latin for the feeling of ants crawling, or zaps, or lightning bolts, or zingers. It's kind of nerves reconnecting. That's a good sign. The second kind of nerve damage that you can have with facelift surgery or neck lift surgery is motor nerve damage, nerves that move the face. It is incredibly rare to get permanent motor nerve damage. The rate in the literature, they say, is 1 in 1,000. I have so far not seen a case of permanent nerve damage. I have seen many, many cases of temporary crooked smiles or weird smiles after facelift surgery. I would put the odds there at about 1 in 30, or about 3%. So far, every case of that I've ever had has completely resolved. Usually 8 to 10 weeks. I saw one take 6 months to come all the way back. This is a perfect example of marginal mandibular nerve weakness on the patient's left. You can see when she smiles and when she tries to show her teeth, she's unable to show the teeth on the left. So it's marginal or cervical branch weakness. Here she is again, about 10 weeks later. That is completely resolved. Her smile is back to normal and she has normal motion again. That is most common. That's the norm. That's what I expect. And again, that only happens in about 1 in 30 patients. So why does it happen? Why can't we prevent it entirely? The nerves are protected by working in layers of the face where the nerves don't exist. So I want to work deep to the nerves or superficial to the nerves. It's kind of like if all the electricity and the wiring for a building runs on the 3rd floor, I know that I need to do all my construction on the 2nd floor, the 4th floor, and the basement. Just stay out of that 3rd floor, you'll protect the wiring. Now the problem is the face has blood vessels in it, and we can't allow bleeding to go unchecked. So if there's bleeding on the 4th floor right next to a nerve, I need to cauterize it. And that cautery, the heat then can transmit and temporarily injure the nerves on the 3rd floor. Similarly, construction on the 4th floor, 2nd floor might exert pressure on the nerves on the 3rd floor or stretch on the nerves on the 3rd floor. So between heat, stretch, pressure, these are temporary injuries. If you cut the nerve, if you're working in the wrong floor and you cut it, well, that can be a permanent injury, although even those are often compensated by other little branches growing out of adjacent nerves. So permanent motor nerve injury in the face is quite rare. Temporary nerve injury, relatively common. I'd call it about 3%. I used to sweat it. I don't anymore. The last thing I want to touch is, does it matter what kind of facelift? Actually, it doesn't. In the literature, the rate of temporary and permanent nerve injuries is the same in little baby SMAS plications compared to deep plane lifts. You would think, since the deep plane lift is deeper and closer to that nerve layer, it should be more risky. In reality, the surgeons that are doing deep plane lifts typically are further along in their career. They have a little more facility, they have a little more skill, they have a little more care, and the rate of nerve damage among experienced deep plane surgeons is exactly the same as among people that do the basic SMAS plication facelifts. So I hope that was helpful. Please put your questions below. And again, if you're one of my patients and you have a temporary weakness and I sent you to watch this video, you can see how this particular patient, she's a cosmetic provider herself, how she improved over 10 weeks. This is totally normal. I tell people by 3 months, almost everyone is back, and the longest I've seen is 6 months. And then I usually finish up by saying, please don't be my first permanent nerve weakness. I've never had one and never want one. Thanks so much.